What are the lymphoma risk factors you should know? Lymphoma, especially non-Hodgkin lymphoma, is a type of cancer that starts in the lymphatic system, which helps your body fight infections. While doctors don't know exactly what causes most cases, they have identified some factors that can increase your chances of developing it. Knowing these can help you understand your health better. But remember, having risk factors doesn't mean you will definitely get lymphoma. Most people with risk factors never develop the disease. Age is a big factor. The risk of non-Hodgkin lymphoma goes up as you get older, with most cases diagnosed in people over 60. But some types are more common in younger adults or even children. Your immune system health also plays a role. If your immune system is weakened, your risk increases. This can happen if you take medications to suppress your immune system after an organ transplant, or if you have conditions like HIV or AIDS. Autoimmune diseases like rheumatoid arthritis, lupus, or Sjogren's syndrome can also slightly raise your risk because they cause your immune system to attack your own body. Certain infections are linked to higher lymphoma risk. Viruses like Epstein-Barr virus, human herpes virus 8, and human T-cell leukemia virus are associated with some lymphoma types. HIV infection increases risk because it weakens the immune system. Bacterial infections, such as Helicobacter pylori, which can cause stomach ulcers, and chronic hepatitis C virus infections, are also connected to specific lymphoma forms. Exposure to chemicals and environmental factors is another risk. Chemicals like benzene, herbicides, and pesticides have been linked to increased risk. For example, exposure to Agent Orange and other herbicides, especially among military veterans, has been associated with lymphoma. Some studies suggest that high levels of weed killers and insecticides may be related, but more research is needed to confirm these links. Family history can also influence risk. If a close relative like a parent or sibling has lymphoma or another blood cancer, your chances might be slightly higher. This is often due to small inherited genetic changes rather than a single gene. Previous cancer treatments, such as chemotherapy or radiation therapy for other cancers, can also increase the risk of developing lymphoma later on. Other factors include obesity, which some studies suggest might be linked to a slightly higher risk, though the connection isn't as strong. Race and geography matter too. In the United States, lymphoma is more common among white populations and in developed countries overall. For those living with or recovering from lymphoma, understanding these risk factors can help guide health monitoring and lifestyle choices. While many risk factors like age and genetics can't be changed, maintaining a healthy immune system, avoiding unnecessary chemical exposure, and managing chronic infections when possible may help lower your risk. It's always best to discuss your personal risk with your healthcare provider, who can give you tailored advice based on your medical history. Remember, most people with risk factors never develop lymphoma, and staying proactive with regular checkups and a healthy lifestyle is key. This information is based on current scientific understanding and guidelines from reputable health organizations. If you have concerns about your risk, talking to your doctor is the safest way to get personalized guidance.